Our sperm donor program is not one of the largest in the country. In fact, it's sort of small in size, but it's extremely high quality.
All our donors are completely anonymous. They are pulled from the three major universities here in San Diego State, University of California, San Diego, and University of San Diego. We obviously are very interested in the donor himself, how he portrays himself, how he presents himself, what his interests are. We also are more concerned with his family history because that's important to any recipient. The donor's going through a rigorous screening process in which we look at his social behaviors, look at his physical aspects, and we also look at his physical screening, which including complete health screen, infectious disease, STD, and a whole health exam. Some patients will come in with a predestined person they have in mind to father their child. And that is what we refer to as a known donor or directed donor. And we also accommodate that here. It's a pretty strict criteria based on federal guidelines as far as making that donor eligible.
Another important aspect of our donors are that we have higher criteria of what we will allow to sell in terms of the numbers of sperm available. In fact, we send a message to the industry by guaranteeing the highest number of motile sperm per vial of anyone that we are aware of. Since we did that, we've seen other programs try to catch up with us, but we continue to set the standard for the industry. And more importantly, once fertility programs have used our product, they find the quality is so far above any of our competitors that they come back to us time and time again. Along that line, we offer an unconditional guarantee that if there is an issue with any of our specimens, that we back it up 100% and we will replace those vials at no charge.
A lot of people will go online and look at the website and kind of just look around looking at our donor profiles. Their next step would be to call in and set up what is called a donor consult, where we sit down with the couple or the individual and just go through all the donor profiles, what they're looking for, kind of like how the process works. The short profile gives height, weight, eye color, hair color, skin tone, facial features, and then the more in-depth profile goes into the family history and the screening questions that we actually ask the donor. Some of the most popular questions we get as far as a donor is, one, is they're good looking? That's usually the number one question. Number two is, what is the donor's personality? That's important to patients. I mean, they can obviously see by the profile and kind of get an idea of what his characteristics are, hair color, eye color, things like that. But they usually like a more descriptive analysis from the staff to kind of give an insight to the donor. They're having to put a lot of trust in us and in our evaluation of that donor and our critiquing of that donor and the information that we're giving them to make them feel comfortable in their choice, because it is a very difficult choice sometimes. And then in other patients, it's a very easy choice. They have a specific criteria. They're not really too concerned about certain aspects. They just have this criteria and they just want to match based on that criteria. And sometimes that's just a photo matching. They want it to match close to the partner. And that's an easy one. It's more when they're really thinking about this donor and this child, it does get kind of an emotional decision for them.